Good morning, everyone. Bonjour à tous. Les derniers temps ont été difficiles pour tout le monde, mais pour certaines familles, les dernières semaines ont été particulièrement déchirantes. A few days ago, we lost 13-year-old Emily Victoria Viegas to this virus. Earlier this month, it was a toddler who hadn't yet turned 2. And tragically, they're not the only children who've been taken by COVID-19. As a father, I know there are no words for the parents' grief. To Emily's family from Brampton, and to the family in BC, and to all parents who've lost a child, and to everyone who's lost a loved one, we are thinking of you. We are grieving with you. And you are not alone. Le virus fait déjà trop de victimes. On doit absolument l'empêcher à causer plus de décès. La troisième vague continue de se prolonger et à travers le pays, le nombre de cas augmente. Les hôpitaux et les travailleurs de première ligne sont à bout de souffle. C'est le moment de travailler tous ensemble. De notre côté, on fait tout ce qu'on peut pour aider les provinces et les territoires à maîtriser la situation. To beat back the third wave and protect Ontarians, we're deploying federal healthcare workers to the province. This mobilization includes 3 medical assistance teams and 9 critical care nurses from the Canadian Armed Forces. Yesterday, the forces carried out their assessment of the needs on the ground in Ontario to finalize the details of this operation. We're working with our provincial partners on next steps, and Armed Forces members will be mobilized in the coming days. Let's be clear. Sending men and women in uniform to help in Ontario is a serious step. We're doing this because the situation requires it. Today, the first deployment of nurses and doctors from Newfoundland and Labrador will also be arriving in Ontario for the GTA. They'll land this afternoon at Pearson aboard a Canadian Armed Forces airplane. Newfoundland and Labrador is already organizing a second team of healthcare workers who will rotate in to help. Our government is covering the costs of deploying these teams, and we're ready to do the same for any other province or territory that can also step in with support. Unfortunately, Ontario is far from the only place dealing with a spike in cases. Across Nova Scotia, and especially in the Halifax region, numbers have risen quickly, and the province requested help. So we're sending support. We're deploying 60 Canadian Armed Forces members to testing centres in Nova Scotia. This will help stop the spread of the virus. For Albertans, too, we're standing ready. Over the weekend, the regional municipality of Wood Buffalo, which includes Fort McMurray, declared a state of emergency. Yesterday, Minister Hajdu talked to Mayor Scott about the outbreak in the region and the situation on the ground. Our government has reached out to Alberta on what support they may need to keep people safe and get the situation back under control. The bottom line is this. Across the country, we're working with provinces and territories to keep you safe. Across the country, we will have your back. And together, we will get through this. That brings me to vaccines, because along with public health measures, these doses are key to beating not only the third wave, but the whole pandemic. This week, we'll get almost 2 million doses delivered to Canada. This includes our first shipment of the Janssen vaccine from Johnson & Johnson. Looking ahead, Pfizer alone will deliver 2 million doses a week starting next week, and will continue to work hard with manufacturers to deliver a stable and growing supply of doses to provinces and territories as they plan vaccination clinics. When it's your turn, make sure you book an appointment to get your shot. Sophie and I got our first doses of AstraZeneca on Friday. We're feeling great, we're feeling more protected, and we're also feeling like we're part of the solution going forward. I want to take a moment to do something I don't often do from this stage. I regularly are talking about our seniors and our young people. I want to take a moment to talk about my generation. over the past number of days, we've seen vaccines made available to people 40 years old and up, and that means Generation X has stepped up and stepped out to get vaccinated. And I want to thank everyone who's been stepping forward and signing up and enthusiastically moving forward. Keep it up. Because of the high uptake, because of everything everyone's doing to get more doses into Canada and into arms, we're now second in the G20 in terms of vaccination doses, and we're going to continue. So thank you to everyone for doing their part. D'un bout à l'autre du pays, les infirmières, les médecins, les pharmaciens et le personnel paramédical travaillent jour et nuit pour veiller à ce que le plus grand nombre de gens possible se fassent vacciner le plus rapidement possible. À tous ceux qui contribuent aux efforts de vaccination, merci. Vous faites un travail incroyable. On travaille sans relâche pour vous fournir autant de vaccins que possible, le plus rapidement possible. Si on regarde le taux d'administration des vaccins, c'est-à-dire le nombre de doses administrées par jour par rapport à la population, le Canada se classe régulièrement au deuxième rang du pays du G20. Notre objectif est d'assurer votre protection et celle de votre famille et d'en finir avec la pandémie le plus rapidement possible. La lutte contre la pandémie est notre priorité absolue. Et pour arriver à vaincre ce virus, il faudra l'éliminer partout. We've all seen the heartbreaking news from hospitals in India that are unable to keep up with the number of patients. Earlier today, Minister Garneau spoke with his Indian counterpart about how Canada can best help, including through the donation of extra medical supplies. We're also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. This will support everything from ambulance services to buying more PPE locally. If you want to donate to the emergency efforts on the ground, go to redcross.ca. I know many Canadians are also concerned about rising cases in Pakistan. Minister Garneau will be speaking to his counterpart from Pakistan later today about the situation and what we can do to help. As a world, we are in this fight together. On espère qu'on est à la dernière phase de cette pandémie. C'est pour ça qu'on doit tenir bon et se protéger les uns les autres un peu plus longtemps. Chaque fois qu'on garde nos distances et qu'on porte un masque, on se rapproche des jours meilleurs qui nous attendent, quand on pourra manger entre amis sur une terrasse ou organiser un grand barbecue familial dans la cour arrière. Et pendant qu'on continue nos efforts, on doit veiller à ce que les gens puissent non seulement traverser cette tempête, mais aussi revenir en force. As we face a she-cession, a recession that disproportionately affects women, we cannot allow anyone to get left behind. That's why, a week ago, we introduced our progressive feminist plan for recovery. So what does that mean for people's lives? Well, for women entrepreneurs, it means almost $147 million to help with financing, mentorship, and training. This is about investing in the kind of entrepreneurs Minister Murray will sit down with today from BC, and the Deputy Prime Minister will speak to from the 51 in Alberta. I know Minister Monsef will also be speaking with women-owned businesses from Toronto about what they need to thrive too. Women-led small businesses strengthen communities and are the backbone of our economy. For mothers, this plan means making sure you have good, affordable childcare to balance work and kids. And I know this will come up when Minister Gould speaks to women business owners from Windsor about our plan to reach $10 a day daycare across the country in the next 5 years. Pour toutes les femmes, dans toutes les régions du pays, il faut adopter un plan féministe et progressiste pour l'avenir qui vise à assurer la sécurité de tous. C'est pourquoi on va de l'avant avec le tout premier plan d'action national pour mettre fin à la violence fondée sur le sexe. Plus tôt aujourd'hui, la ministre Bibeau ainsi que les députés Brière et Bessette ont rencontré différents groupes de cantons de l'Est pour discuter de notre plan et des manières d'assurer la sécurité de tout le monde. La dernière année a été très difficile, que vous soyez parent, propriétaire d'une petite entreprise, étudiant ou personne âgée. mais de meilleurs jours nous attendent. Et grâce à notre plan, on va créer de bons emplois pour la classe moyenne, rebâtir une économie propre et résiliente et bâtir un Canada plus juste pour tout le monde. Merci. Je suis maintenant heureux de passer la parole au ministre Blair. Bill.
Thank you very much, Prime Minister, and good morning, everyone. As the Prime Minister mentioned, in response to a request for assistance received from the province of Ontario, we've been working with the Canadian Armed Forces, the Canadian Red Cross, and medical personnel from Newfoundland and Labrador in order to help fight COVID-19 in Ontario. We have today identified 62 health human resources from federal departments across the country who have been identified as potential volunteers to be deployed to Ontario. The Canadian Armed Forces is also deploying 9 ICU nurses and up to 3 multi-purpose medical assistance teams. In addition, the Canadian Red Cross is prepared to deploy an initial group of 13 nurses with ICU and emergency response experience, and they are prepared to deploy up to 30 additional resources. And finally, as the Prime Minister mentioned, today 6 nurses and 3 physicians from Newfoundland have begun to travel to Ontario in order to provide much needed help, and that will increase up to 14 nurses in the coming weeks. And at the same time, we are working with the province of Nova Scotia to help them fight back rising numbers of COVID cases. And we have approved today an RFA, a request for assistance from the province of Nova Scotia. And we will be deploying 60 Canadian Armed Forces members to testing centres in that province. Over the past year, there have been 70 requests for assistance received from the provinces and territories, including 22 from the province of Ontario. In every instance, we have worked with our provincial and territorial partners, and we have marshaled our resources to help out. And for example, we have provided resources to help our seniors in long-term care homes. We have provided assistance to support temporary foreign workers in safe isolation sites and who come to this country to help Canadian farmers. We have been assisted in responding to hotspots with mobile health units, and we have been working in remote communities and Indigenous communities across the country to boost capacity in those communities. We will continue to work with the Canadian Armed Forces, the Canadian Red Cross, and our partners in every province and territory to continue this fight. And we will work collaboratively with our provincial and territorial partners. And as we do this important work, I want to urge all Canadians, follow the public health guidelines, wear your mask, and get your vaccine as soon as you are eligible. It's only by working together that we can beat this. Thank you very much.
Dr. Tam?
Good afternoon and bonjour à toutes et à tous. This week is National Immunization Awareness Week in Canada. And across generations, Canadians are recognizing the importance of vaccination for saving lives and preserving health, well-being, and livelihoods. First, we'll update the numbers, then focus on the importance of vaccines among other public health measures to control serious infectious diseases. To date, close to 1,190,000 cases of COVID-19, including over 24,000 deaths, have been reported in Canada. And over the past week, a somewhat lower average of just over 8,000 cases were reported daily, while the number of people experiencing severe and critical illness continued to rise. On average, over 4,300 people with COVID-19 were being treated in our hospitals each day, including 1,350 people being treated in intensive care units, representing over 15% increases compared to the prior week. At the same time, an average of 51 deaths were reported daily, which is also 15% higher than the week prior. There are over 94,200 variants of concern cases reported to date across Canada, with the B117 variant accounting for 96% of these. A year ago, during National Immunization Awareness Week, we talked about how vaccines played a significant role in preventing and controlling the spread of serious, life-altering, and sometimes fatal diseases like measles, pertussis, influenza, diphtheria, and polio in Canada and around the world. We ended by saying a vaccine may also one day be available to prevent and control the spread of COVID-19. So what a difference a year makes. And not only do we have many examples of the life-saving benefits of vaccines across the infectious diseases landscape, but wherever COVID-19 vaccines have been rolled out, we're starting to see what a difference they make. In fact, prior to the pandemic, vaccines were credited for saving 2 to 3 million lives each year. Now, with over 3 million reported deaths due to COVID-19 worldwide, it is clear that these safe and highly effective vaccines have a big role to play in ending the pandemic and averting millions more deaths. And the benefits of COVID-19 vaccines are increasingly being seen in Canada as well. For example, thanks to Indigenous leadership on a range of public health measures and on the early deployment of vaccines supported by all levels of public health and the Canadian Armed Forces, over 340,000 vaccine doses have been administered in over 650 Indigenous and territorial communities. With increasing vaccine uptake, active COVID-19 cases have dropped more than 80% in First Nations communities in the past 3 months. It is enormously encouraging to see how vaccination is serving to protect higher risk communities. Similar benefits have been seen in other high-risk populations targeted for priority vaccination. With vaccines rollout expanding every day, we can expect to see these benefits across the Canadian population. Vaccines are an incredibly important public health tool throughout our lifespan, from protecting children against serious and life-threatening infections to preserving and prolonging health and well-being into our senior years. But when it comes to tackling a pandemic with widespread and elevated levels of risk, we must maintain other vital public health measures to bring the infection rate down and keep it down as vaccines roll out across the population. That means keeping up with individual precautions and public health measures in your area until we've built the bridge for vaccines to take us to greater safety and back to the things we have missed so much. Thank you.
Bonjour à toutes et à tous. Cette semaine est la Semaine nationale de promotion de la vaccination au Canada. Toutes générations confondues, les Canadiens reconnaissent l'importance de la vaccination pour sauver des vies et préserver la santé, le bien-être et les moyens de subsistance. Nous ferons d'abord le point sur les chiffres, puis nous nous concentrerons sur l'importance des vaccins parmi d'autres mesures de santé publique visant à contrôler les maladies infectieuses graves. À ce jour, près d'1,190,000 cas de COVID-19, dont plus de 24 000 décès ont été recensés au Canada. Au cours de la dernière semaine, une moyenne légèrement inférieure d'un peu plus de 8 000 cas a été signalée chaque jour, tandis que le nombre de cas graves et critiques a continué de croître. En moyenne, plus de 4 300 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont 1 350 personnes étaient traitées dans des unités de soins intensifs, ce qui correspond à des augmentations de plus de 15 par rapport à la semaine précédente. Au cours de la même période, en moyenne, 51 décès ont été recensés chaque jour, représentant également 15 de plus que la semaine précédente. Nous enregistrons plus de 94 200 cas de variants préoccupants à ce jour au Canada. Le variant B117 représente 96 de ceux-ci. Il y a un an, à l'occasion de la Semaine nationale de promotion de la vaccination, nous avons expliqué le rôle important des vaccins dans la prévention et le contrôle de la propagation des maladies graves qui changent de vie et sont parfois mortelles, comme la rougeole, la coqueluche, la grippe, la diphtérie et la polio, au Canada et dans le monde entier. Nous avons terminé en disant qu'un vaccin pourrait aussi être disponible un jour pour prévenir et contrôler la propagation de la COVID-19. Quelle différence en un an! Et non seulement nous avons un grand nombre d'exemples des avantages vitaux des vaccins dans le domaine des maladies infectieuses, mais partout où les vaccins contre la COVID-19 ont été administrés, la situation commence à changer. En fait, avant la pandémie, on attribuait aux vaccins le mérite de sauver de 2 à 3 millions de vies chaque année. Alors, nous recensons aujourd'hui plus de 3 millions de décès attribuables à la COVID-19 dans le monde. Ces vaccins sûrs et très efficaces sont manifestement essentiels à nos efforts visant à arrêter la pandémie et à éviter des millions de décès supplémentaires. Nous pouvons bénéficier de plus en plus des avantages des vaccins contre la COVID-19 au Canada également. Par exemple, grâce au leadership autochtone à l'égard d'une série de mesures de santé publique et au déploiement précoce des vaccins soutenus par les autorités de santé publique à tous les niveaux et les forces armées canadiennes, plus de 340 000 doses de vaccins ont été administrées dans plus de 650 communautés autochtones et territoriales. Grâce à la hausse des taux de vaccination, le nombre de cas de COVID-19 actifs a chuté de plus de 80 dans les communautés des Premières Nations au cours des 3 derniers mois. Il est extrêmement encourageant de voir comment la vaccination sert à protéger les communautés à haut risque. Des avantages semblables ont été observés dans d'autres populations à haut risque qui avaient été ciblées pour être vaccinées en priorité. Comme nous vaccinons de plus en plus de personnes chaque jour, nous pouvons nous attendre à ce que toute la population canadienne puisse bénéficier de ces avantages. Tout au long de notre vie, les vaccins sont un outil de santé publique incroyablement important. Ils protègent les enfants contre des infections graves et mortelles. Ils préservent et prolongent la santé et le bien-être de nos aînés. Mais pour lutter contre une pandémie ayant des taux de maladie élevés et généralisés, nous devons prendre d'autres mesures de santé publique vitales pour abaisser le taux d'infection et le maintenir bas jusqu'à ce que les vaccins soient offerts à toute la population. Ainsi, nous devons appliquer les précautions individuelles et les mesures de santé publique dans notre région jusqu'à ce que nous ayons atteint l'immunité que nous permettra d'être en sécurité et de profiter à nouveau des choses que nous avons tant manqué. Merci.
Merci, Dr. Njoo. Le premier ministre prendra 6 questions en commençant par le téléphone. Une question, une sous-question. Les ministres et docteurs demeureront disponibles pour 15 minutes par la suite. Thank you. The Prime Minister will take 6 questions today, starting with the phone. Ministers and doctors will remain available for another 15 minutes after. Opérateur, c'est à vous.
Thank you. Merci. Please press star 1 if you have a question. S'il vous plaît, appuyez sur étoile 1 si vous avez une question. The first question is from Tanda McCharles from the Toronto Star. Please go ahead.
Yes, good morning, Prime Minister. I'd like to hear your response to Ontario's request for the federal government to double sick leave benefits, and they would reimburse you for the extra $500. Will you do that? Will you do that for Ontario, and will you do that deal for all provinces?
Thank you, Tonda. First of all, as we see the news from Ontario and across the country in places affected by this third wave, our heart goes out to the families facing tragedies, the essential workers in workplaces who are worried about bringing home the virus, who are continuing to need to go to work. This is one of the reasons we brought in a federal sick leave program that individuals could directly apply for many months ago. We know that it's an important piece of the puzzle. At the same time, the Deputy Prime Minister and Finance Minister is engaged directly with the province of Ontario to support them as they look at further measures to ensure that nobody has to make the choice of going to work sick. One of the most efficient ways of doing that is obviously to work through employers, as we have through federally regulated workplaces. And I know the Deputy Prime Minister is working directly with the province of Ontario to ensure that the right supports get there for people as quickly as possible. As we've said, we are there to help Canadians. We have people's backs. We need to work together, and provinces need to look at the way to deliver sick leave directly through employers, which the federal government can't do.
Following up, Tonda?
Yeah, thank you. That actually sounds like a no to Ottawa tweaking its system to deliver the benefit and getting a reimbursement from the province. And if I'm wrong on interpreting the last sentence there that way, please correct me. But you did say in your prepared remarks about, the federal government wants to tell parents like Emily Viega's parent, that they're not alone, but many of them do, especially essential workers, do feel alone in all of this. So if the Ford government says to you the best way to do this is for you guys to cut the check and they reimburse you, why wouldn't you do that?
First of all, the Deputy Prime Minister is engaged directly in conversations with the appropriate authorities and officials in Ontario, and she is engaged on that. I know she's put out a statement earlier this morning, and she is very much the lead on this in terms of making sure that we are there to support Ontario in getting this help to Canadians the right way as quickly as possible. That's what we all want on this, and we need to make sure we're using the right tools, and I have tremendous confidence in the Finance Minister to stick-handle this and make sure that we are getting that support to people. Like I've said, from the very beginning of this pandemic, federal government made a promise to have people's backs through this as much as it takes, as long as it takes. That's why 8 out of every $10 in pandemic support across this country came from the federal government. We will continue to look at every way we can support the provinces as they do what they need to do to keep people in their jurisdictions safe. We are there to support in any way that will work, and that's what the Finance Minister is working on right now with Ontario.
Thank you. Operator, next question on the phone.
La prochaine question est de Marie-Pastel Ledevoir. La parole est à vous.
Oui, bonjour, M. Trudeau. J'aimerais revenir sur cette annonce de l'Union européenne qui a dit que les Américains qui seront pleinement vaccinés pourront y entrer cet été. Je voulais savoir qu'en est-il au Canada. Il y a quelques semaines, je vous ai posé la question. Vous étiez en consultation, en réflexion. Donc, où en êtes-vous dans votre réflexion? Je comprends que c'est pas le temps de voyager, que les Canadiens ne devraient pas penser à ça. Donc, je vous épargne de me le répéter dans votre réponse. Mais il y a aussi des Canadiens, pas juste des touristes, qui aimeraient revenir au Canada pour voir leur famille, pour voir leurs proches. Est-ce que les règles vont être assouplies pour eux à leur retour s'ils ont reçu leurs 2 doses de vaccin ou une dose d'un vaccin à une dose? Et qu'en est-il pour les touristes américains qui pourraient vouloir venir cet été et aider à la relance de l'économie?
Il y a 1 an, Marie, on a pris les mesures sans précédent de fermer nos frontières aux touristes. Et je comprends que ça a eu des impacts sur eux, sur leur plan, mais ça a aussi eu des impacts importants sur les petites entreprises des régions à travers le pays qui en ont arraché à cause de cela. Mais nous avions pris cette décision parce que, d'abord et avant tout, nous devions protéger les Canadiens de ce virus. C'est pour ça qu'on a amené beaucoup d'autres mesures, que ce soit la quarantaine, que ce soit les tests de dépistage multiples, que ce soit des mesures pour fermer des vols en plus. Et à chaque étape, nous allons laisser nous laisser guider par la science et nous allons mettre la priorité sur la protection des citoyens. Les scientifiques et les experts sont en train de regarder attentivement l'impact de la vaccination, de la pleine vaccination sur la transmissibilité, par exemple, des virus. Et nous allons continuer à travailler avec nos partenaires à travers le monde pour s'assurer que quand le moment viendra, on pourra rouvrir et relâcher de la bonne façon, peut-être effectivement avec des certificats de vaccination nécessaires, mais nous n'en sommes pas là, comme vous aviez très bien dit, mais nous allons continuer de s'assurer que quand le moment viendra, on pourra le faire de la bonne façon pour garder et assurer la sécurité des Canadiens.
En suivi, Marie.
Oui, mais quand pensez-vous avoir des réponses à ces questions? Parce que je comprends que nous, on n'en est pas à ce que tout le monde soit complètement vacciné, mais il y a d'autres pays où c'est déjà le cas. Donc, quand est-ce que vous pensez avoir des nouvelles à ce sujet? Et puis, en sous-question, sur les doses d'AstraZeneca que les Américains sont prêts à partager avec d'autres pays, avez-vous obtenu une garantie que le Canada fera partie de ces pays bénéficiaires? Savez-vous à quelle date on pourrait commencer à recevoir des vaccins et quelle quantité serait réservée pour le Canada?
Tout d'abord, encore une fois, nous sommes en train de regarder la situation, mais nous sommes en pleine troisième vague maintenant et notre priorité, c'est sur la sécurité des Canadiens maintenant. Oui, on prépare des plans pour des ouvertures éventuellement, mais c'est trop tôt pour parler de quand et comment et quelles seront les modalités. Nous nous concentrons sur cette troisième et on l'espère dernière vague de cette pandémie et c'est pour ça que les gens doivent tenir bon. Par rapport aux conversations avec les Américains, j'ai eu un très bon appel avec le président Biden la semaine passée. Nous sommes en train de leur parler régulièrement et on espère avoir des nouvelles bientôt. Mais je pourrais peut-être passer à la ministre Anand pour ajouter quelque chose, mais pour l'instant, on n'a rien à annoncer tout de suite. Anita, anything to add?
Bien sûr, Monsieur le Premier ministre, nous continuons à travailler en étroite collaboration avec l'administration Biden et je suis en contact avec mon homologue là, Jeffrey Zients, ainsi qu'avec notre ambassadrice Kirsten Hillman aussi. Nous avons déjà reçu 1,5 million de doses d'AstraZeneca, comme vous savez, via les États-Unis en mars, grâce à notre accord existant pour 20 millions de doses du vaccin. Nous avons hâte de mettre les Canadiens au courant qu'il y aura des détails supplémentaires à partager et nous avons eu une conversation avec les États-Unis hier et nous voulons partager l'information certaine quand nous avons cette information. Merci beaucoup.
Merci. Opérateur, dernière question au téléphone.
Thank you, merci. The next question is from Ryan Tumulty from the National Post. Please go ahead.
Yeah, good morning, sir. You're announcing today more supports headed to the provinces in a variety of ways, but you've offered the provinces rapid tests that have gone unused. You've offered them a drug treatment from Abcellera that went unused, and you've offered them support from Statistics Canada for contact tracing, which is largely going unused. Are you concerned that some of these supports that you roll out actually don't get used by the provinces?
Our job as a federal government is to be there with the supports that are needed, and that's what we have continued to do. We respect provincial jurisdiction and provincial decision-making, but every step of the way, we will work to fulfill the promises we have made to Canadians about having their backs, and that's exactly what we've done. So whether it's, as you list, rapid tests, contact tracing resources, further supports across the country, we will continue to do that. And it's, I think I can turn to Bill Blair right now to highlight some of the further efforts and the conversations going on with the provinces as we speak to ensure that they use all the help that we are offering them. Bill.
Minister Blair?
I'm sorry, I was on mute there. We maintain a government operations center, which has the responsibility for the federal government of collaborating and working very closely with all of our provincial and territorial counterparts. And so there is a daily discussion going on between our two orders of government on how we can support each other, the very, very careful monitoring of the emerging situation in each of the provinces. And you know, I think it's also fair to acknowledge that some of the provinces have had very different requirements of the government, and that's why we also respond as quickly as possible, as I've said over 70 times now, to requests for assistance received from the provinces. There are consistencies in some of those requests, but each of the provinces has unique needs, and we respond as they require.
Thank you. Following up, Ryan?
Yeah, sir. In the case of the rapid tests, the government has paid over $1 billion for the rapid tests that it's ordered so far. And like I said, many of them haven't been used. The Abcellera treatment cost your government $40 million, and it's largely gone unused. Do you think there was a breakdown in the communication between you and the provinces in terms of buying a lot of equipment that isn't being used?
We have continued to reach out to ensure that we have all the potential equipment that we need, all the potential materials. The announcement we made last week about potential vaccine boosters for the coming number of years is another example of how we would much rather be ready and prepared with equipment that doesn't get used as much as we might have worried that it would be needed, rather than not have equipment ready in cases where it is needed. One of the things we've done consistently is on rapid tests, reached out not just to provinces, but directly to municipalities, to large employers, and to pharmacies, and a range of partners across the country to ensure that they also have opportunities to avail themselves of the rapid tests as an extra screening capacity to make sure we get this virus under control. The federal government has pulled out all the stops, and we will continue to make sure that we're doing everything we can to get through this as quickly as possible. Because it's not just about saving lives and making sure our lives get back to normal as quickly as possible. It's also about knowing that investments that we can make that will bring our economy back quicker will be good for everyone as well and are more than worth it.
Merci. On va maintenant passer à les
Prime
questions.
Minister, I might just add something, if I could, to that response. And that is that we don't know what stages and phases the pandemic is going to take in any given situation. And that is why at the beginning of the pandemic, when we ordered PPE, when we ordered rapid tests, we made sure to put into place long-term contracts to prepare for any eventuality. And indeed, those contracts are continuing to be useful in terms of the deliveries that have continued to arrive over time. One key example is on ventilators. We put into place contracts for the supply of ventilators early on in the pandemic last spring. And we are seeing now a rise in the use of ventilators because Canada is in the middle of a third wave. Therefore, as the Prime Minister mentioned, it is so very important for us to be prepared across the board, across the various categories of PPE and supplies, so that we can stand ready via the Public Health Agency of Canada to support the provinces and territories in terms of whatever requests they are putting forward, including on rapid tests. Thank you.
Merci. Juste un petit rappel avant de passer aux questions dans la salle au ministre d'aller voter. Just a little reminder for ministers to go vote, and the PM will continue to take questions. Monsieur Blouin.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada.
Did Ryan not get a follow-up? Oh, you did? Okay, sorry.
M. Trudeau, il y a des délais dans le traitement des tests de dépistage pour les gens qui sont en quarantaine. Il y a des voyageurs, des travailleurs temporaires qui, dans certains cas, doivent attendre jusqu'à 26 jours pour avoir le résultat de test, qui est fait à peu près à 10 jours après le début de la quarantaine. Comment pouvez-vous expliquer ces délais-là? C'est votre gouvernement qui est en charge de ça. Qu'est-ce que vous allez faire pour essayer de résorber la situation et peut-être dans quel délai?
Je suis très préoccupé par cette situation. On est en train de changer l'échéancier du test de dépistage mi-quarantaine d'être au jour 8 pour avoir les réponses plus rapidement, les résultats plus rapidement qu'avant. Mais en même temps, j'ai aussi demandé à mon équipe et au ministre de regarder attentivement ce qui se passe avec ce contrat et cette compagnie à qui on a confié la tâche de veiller à ça. C'est une situation qui me préoccupe énormément et j'ai demandé des réponses. We are very concerned about the situations reported on testing delays and result delays that are having an impact on Canadians in quarantine and indeed on temporary agricultural workers, amongst others. We are moving the date of the day 10 test to day 8 now to allow for earlier results while people are in quarantine. But I've also asked officials and ministers to look very carefully at the contract awarded in this case of providing testing services and ensure that we are fixing this situation that is very troubling.
Hi, Prime Minister Tom Perry with CBC. On India, you're obviously giving some aid to India at this point. Is there more that you could be doing, though? I'm thinking oxygen, I'm thinking ventilators. And do you need to get a formal request from India before you can move ahead with anything like that? Where does that stand?
As I said, Minister Garneau, our Foreign Affairs Minister, has had direct conversations with his Indian counterpart. He will be speaking with the Foreign Affairs Minister of Pakistan later today. We are there to support in any ways we can, and those conversations are very much ongoing. It's something that Canadians are extremely concerned about as we see the terrible and tragic images coming out of India. We know that we need to be there for our friends, and indeed, we need to be there for everyone around the world, because we don't get through this pandemic anywhere until we get through it everywhere.
And just on India also, we are across government with, as Prime Minister said, with Minister Garneau and Minister Gould and I have been coordinating to ensure that we are mounting as much assistance as possible that we can from Canada to India. And in that regard, I have been in touch with Nadir Patel, our High Commissioner in India, as well as Ajay Basaria, India's High Commissioner in Canada, to ascertain the precise supplies that are needed in India and how best Canada can support the needs that India clearly has and that we clearly want to lend a hand with. Thank you.
Good morning, or good afternoon, Prime Minister. Theresa Wright with the Canadian Press. The United States has said it will share up to 60 million doses of AstraZeneca with the world once it clears its federal safety reviews. Given that you keep saying Canada expects to have more than enough doses in the coming months, does Canada plan to accept these doses from the United States? Do we have enough or do we not?
Those conversations are obviously ongoing. I had a good conversation with President Biden last week on this and other topics. Canada is positioned to receive close to 50 million doses of vaccine before the end of June. So it is all a question of timing. We know that we have capacity to deliver vaccines immediately into more arms as we can get more vaccine doses into Canada. So we are continuing to work every single day to try and get those doses into Canada to increase our capacity on vaccination. And indeed, it is not about taking vaccines from the rest of the world, because we have such significant contracts for all the major vaccines that are out there right now. It is a question of simply moving up timings and exchanging doses so we can get through our vaccination quicker and all the quicker turn to supporting people around the world. Nous attendions à recevoir plus de 50 millions de doses de vaccins d'ici la fin juin. Alors effectivement, nous allons recevoir beaucoup de vaccins. Nous allons avoir tout le monde vacciné avant la fin septembre, ça c'est promis. En même temps, nous savons que de recevoir des doses plus rapidement va nous permettre de passer à travers plus rapidement et de tourner notre regard vers l'aide aux autres pays dans le monde le plus rapidement possible. Et donc, nous allons continuer de travailler pour avoir des doses plus rapidement au Canada pour pouvoir passer à travers.
Minister, it's Annie Bergeron-Oliver with CTV National News. I just want to follow up on the idea of a vaccine certificate. You just mentioned that the government is considering it, but they're not quite there yet. Based on your own timeline, though, we're only about 5 months out from having every Canadian adult who wants a vaccine to be able to be fully vaccinated. That timeline you've mentioned is end of September. So if the EU and the US move forward with this idea of having a vaccine certificate, won't those fully vaccinated Canadians be at a disadvantage? And when that border does reopen, are you anticipating having every single traveler who comes to Canada, will there be a requirement to make them fully vaccinated?
We are, of course, looking very, very carefully at this issue, even as we are in the third wave right now, dealing with extremely urgent and difficult situations. We continue to plan for how we reopen the economy, how we reopen our borders, how we get back to normal, which is something that all Canadians want to do. And obviously, as was the case pre-pandemic, certificates of vaccination are a part of international travel to certain regions and are naturally to be expected when it comes to this pandemic and the coronavirus. how we actually roll that out in alignment with partners and allies around the world is something that we're working on right now to coordinate. I can assure you that our decisions will be based on science, and the fact that those decisions are ongoing and those discussions are ongoing right now means that we will be aligned with our partners around the world.
Sounds like a yes, it will likely happen.
We are working on it on a scientific basis, and we will have more to announce when we have to announce. Right now, we're focused on getting through this pandemic and being prepared to come roaring back once we're through it. Okay. Évidemment, les certificats de vaccination font déjà depuis longtemps partie du système de voyages internationaux. Nous allons évidemment travailler avec nos partenaires aux États-Unis, en Europe et partout dans le monde pour s'aligner dans nos mesures et comment on traite les voyageurs selon qu'ils soient vaccinés ou non. Mais la réalité, c'est qu'on n'est pas rendu là encore. On a encore du travail pour passer à travers cette troisième vague, mais ces conversations et cette coordination est en train de se passer. Le Canada fera partie du consensus à condition qu'on soit basé à chaque étape sur la science et ce qu'on fasse soit sécuritaire pour les Canadiens.
Prime Minister Michael Couture with Global National. It seems like the list of people who knew about concerns about General Vance in your government is growing longer. We had Minister Sajjan, his chief of staff, senior advisor in your office, and now we're hearing that your closest advisor, Katie Telford, knew. Should she have told you about these concerns about the top soldier in our military?
Thanks, Mike. Let me sort of first say that the situation that is faced by far too many women and men serving in our military of harassment, intimidation, assault is absolutely unacceptable. And as a government, from the very beginning, we move forward with measures to create greater support and greater recourse for anyone who comes forward from the military or from other places with concerns or allegations or experiences that that they've had to survive. We will always be there to support and to ensure that those survivors are listened to and recognized for the strength and the courage that they demonstrated by coming forward in sometimes very difficult situations. When an allegation, a complaint, concerning General Vance was brought forward to the minister, he forwarded it to the appropriate authorities at the PCO to follow up on it. It is not appropriate for politicians to be the ones following up on these. The minister, my office, knew there was a complaint against General Vance. Nobody knew that it was a Me Too complaint. We did not have information on what was the nature of that complaint, of that allegation. When the appropriate authorities, when the PCO received the information, they were unable to get the further information necessary on the details because the ombudsperson didn't have permission to share. Now, this highlights the situation that unfortunately is far too real for far too many people facing this, in that they don't feel like there is a process that supports them and protects them because of the strength of the culture that has allowed this for far too long within the military and within other systems. And that's why we made movements and we made investments and we made changes to the system over the past years, but it's why we need to do so much more, so much faster to ensure that anyone who comes forward with these experiences or experiences these types of harassments or assault or issues is supported and given the right resources and comfort to be able to come forward and launch a process. That is what we are focused on as a government, and that is why we will continue to be there and do everything we can, as we have from the very beginning, to support people coming forward with these sorts of experiences and allegations. Comme je dis depuis le début, quand le général Sajan, le ministre Sajan a été mis au courant qu'il y avait des allégations contre le général Vance, il a travaillé avec mon bureau et il a envoyé cette plainte aux autorités responsables qui avaient la capacité de faire des suivis sur une telle plainte. C'est pas la place de politiciens de faire des suivis là-dessus. C'est à des autorités responsables de le faire. Le ministre savait, et d'ailleurs mon bureau savait qu'il y avait une plainte, mais personne ne savait c'était quoi la nature de cette plainte. Et quand le bureau du conseil privé a voulu faire un suivi, l'ombudsperson n'a pas pu partager plus d'informations parce qu'il n'y avait pas la permission de le faire. Et ça souligne l'enjeu préoccupant que les gens qui sont survivants d'incidents comme cela, d'expériences négatives, néfastes et inacceptables dans les forces armées, ne se sentent pas appuyés ou ressourcés adéquatement dans le processus pour partager. Et c'est à ça que nous nous attaquons depuis plusieurs années, mais évidemment, nous devons d'en faire encore plus parce que c'est évident que la culture doit changer de façon radicale à l'intérieur des forces armées et c'est ce sur quoi nous allons continuer de travailler à chaque étape.
Just as a follow-up, how disappointed are you when you hear of the allegations that these women are bringing forward and what they've been through? How disappointed are you that you didn't hear about it until this year?
As I've said, this is an issue that this government and me personally, with Katie Telford being an extraordinarily strong leader in this, we have taken seriously since day one. It's because of Katie that I have sat down with multiple women leaders within the armed forces and elsewhere to have conversations about this over the years, to look at what more can and should be done. Katie's leadership on this every step of the way is why we call ourselves a feminist government and why we will continue to look to do more. I've been working and engaged in the issue of fighting sexual assault and harassment since my university days. And it is always extremely heart-wrenching to hear stories of people who went through horrible experiences and then for years and in many cases decades had to live with that and couldn't feel like they had any recourse, had any support, could come forward and share and see consequences and see a process and see change move forward. So it's those two elements that we have to work on. We have to make sure, first and foremost, that nobody goes through unacceptable incidents of harassment, intimidation, assault in their workplace, anywhere, particularly in the Canadian Armed Forces. But also that if the unthinkable does happen, that they have recourse and support and systems there to make them feel supported and able to go through with getting accountability. This is something that we have always worked on extremely hard as a government, as a team, and we will continue to every step of the way.
Thank you, Prime Minister. This is all the time you have with us today. C'est tout le temps que vous avez avec nous aujourd'hui. On va maintenant retourner au téléphone pour les questions avec les ministres et docteurs. Opérateur, c'est à vous.
Thank you, merci. La prochaine question est de Catherine Lévesque, la presse canadienne. La parole est à vous.
Oui, bonjour à vous tous. Bon, il y a une question que j'aurais aimé poser à M. Trudeau, mais je vais vous la poser à vous, M. LeBlanc. Il y a Jack Meeting du NPD ce matin qui dit qu'il est prêt à utiliser tous les outils possibles pour montrer son opposition au projet de loi là, sur le port de Montréal. Je me demandais peut-être, en tant que représentant du gouvernement, est-ce que vous craignez que le NPD fasse un filibuster là, pour retarder l'adoption du projet de loi?
Nous espérons évidemment que la Chambre des communes, au bon moment, va procéder à appuyer un projet de loi pour le retour au travail du port de Montréal. Comme nous avons indiqué depuis longtemps, nous sommes engagés avec les deux côtés dans cette question depuis plusieurs mois. Et à un moment donné, le consensus au Québec et l'importance pour l'économie canadienne et surtout dans le contexte d'une pandémie nécessite de l'action gouvernementale. On comprend que le NPD vont toujours résister à ces projets de loi pour le retour au travail. Cependant, comme gouvernement, nous avons l'obligation de prendre des responsabilités pour la sécurité des Canadiens, pour l'économie canadienne et franchement pour les travailleurs et les gens qui dépendent au Québec et à travers le Canada sur le bon fonctionnement économique de ce port si important pour notre pays. Alors, moi, je suis au Parlement depuis 20 ans. J'ai vu le NPD pendant plusieurs années résister à ce genre d'action gouvernementale, mais nous n'avons pas le luxe d'être idéologique. Nous avons l'obligation d'être à l'avant-garde de l'intérêt des Canadiens. Et c'est pourquoi, après maintes reprises en termes de négociation, nous avons accepté cette responsabilité importante.
In English, Minister LeBlanc.
So in English, if I can, as my colleagues, the Minister of Labour, the government House Leader, have indicated for many days, our government has been involved in supporting both parties in terms of the labour dispute at the Port of Montreal. We have been involved in supporting both parties in mediation efforts because we always prefer to see a negotiated settlement at the bargaining table. However, in the context of a pandemic, when so much important material for Canadians, including medical supplies, medical equipment, transit through that essential port for the economy of Canada, at one point, the government has to take its responsibility. Once the union had indicated there was going to be a general strike, we've heard the province of Quebec, we've heard Premier Legault, we've heard the business community across the country, and we've also heard from workers whose jobs depend on that important economic infrastructure for Canada functioning, and that's why we have taken our responsibility in this regard.
En suivi, Catherine?
Oui, merci beaucoup. Sur un autre sujet, je voulais vous entendre là, sur une autre demande du gouvernement de l'Ontario par rapport aux voyages interprovinciaux, parce que là, on le sait, bon, la frontière est fermée là, avec l'Ontario. Par contre, il y a encore des vols là, intérieurs entre l'Ontario et le Québec, par exemple. Et là, l'Ontario vous demande d'ajouter des restrictions là, pour limiter ces voyages-là. Je me demandais, est-ce que c'est l'intention du gouvernement fédéral là, d'agir sous sa juridiction pour peut-être restreindre les voyages en ce sens? Merci.
Merci pour la question. Comme nous avons dit depuis longtemps, évidemment, ce n'est pas le moment de voyager. On a vu dans d'autres régions du pays, que ce soit les territoires du Nord ou que ce soit les provinces de l'Atlantique, nous avons vu les gouvernements provinciaux prendre des mesures nécessaires pour limiter des voyages entre des provinces. La réalité, c'est que le fils de mon épouse, qui est étudiant ou qui travaille à Halifax, ne peut pas venir 2h30 à Moncton voir notre famille. Ma parenté qui se trouve à Montréal ne peut pas prendre des avions nécessairement pour arriver au Nouveau-Brunswick sans être obligé d'avoir la permission du gouvernement du Nouveau-Brunswick pour entrer dans la province. Alors, foncièrement, c'est une responsabilité provinciale, l'idée de fermer les frontières provinciales à des voyages, à des voyageurs. Cependant, nous sommes toujours intéressés de travailler avec les provinces. Je sais que mon collègue, le ministre des Transports, est en train d'examiner, par exemple,
qu'est-ce qu'on peut faire en termes de surveillance accrue aux aéroports, mais ce sera forcément un partenariat avec le gouvernement de l'Ontario parce que, en bout de ligne, c'est leur juridiction, mais nous serons toujours là pour les appuyer et nous sommes toujours là, évidemment, pour déconseiller les gens de voyager, de quitter la maison pour des raisons non essentielles.
Merci. Opérateur, prochaine question au téléphone.
Thank you, merci. The next question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good morning. Thanks so much for taking my questions. My first question is for Minister Anand. Fort McMurray has asked for more vaccines to help deal with its state of emergency. Will the federal government at all be increasing the vaccines that it sends to Alberta for Fort McMurray, or is it staying to the per capita distribution?
I will start off, Marika, and then I will ask Dr. Tam or Dr. Njoo from the Public Health Agency of Canada to supplement my answer because they interface with the provinces, whereas I am more responsible for getting doses into the country. We have received 14.4 million doses to date. We've seen the provinces administer 12.4 million doses. And we now see 30% of the population in Canada having been vaccinated. We are aware that there are hotspots and there are requests for additional vaccine supplies. But as you know, at the current time, the general distribution mechanism that the provinces put in place with PHAC and the Government of Canada through an agreement remains in place. But I will ask Dr. Njoo or Dr. Tam if they'd like to supplement that answer.
Yes, this is Theresa Tam. So I think the biggest shift in terms of support to the provinces from the vaccine front is, of course, there is an actually increase in supply coming in. So this week there'll be a increase in supply overall. So that should help Alberta. And I know that within each of the provinces, they have their strategies for targeting hotspots as they observe their own epidemiology. So that has been a strategy to date. And of course, we can have further discussions. But you can imagine, Toronto might say, well, we have hotspots. Alberta will have hotspots. British Columbia will have hotspots. And it's a complex picture. So by just increasing the supply of vaccines coming in, I think this should assist the provinces into making some of their internal decisions to reallocate as appropriately as possible. And we've seen this happen actually in many provinces where they have mobilized different vaccines to different areas of need. But that's been the strategy to date.
Following up, Marika?
Yes, thanks so much. My next question is for Minister Blair. The Prime Minister last week said that the federal government had identified up to 100 people that could be sent to Ontario. You're now saying, I believe, that it's 62. Can you please specify who those people are, why it's lower than last Friday, when they will be going to Ontario, and in addition, can you also clarify the total number of Canadian Forces members going to Ontario?
Thank you, America. As I indicated in my remarks, we've identified 62 health resources from federal departments to date. That work is ongoing, but what we've identified them, and they come from such departments. For example, we have medical personnel in Correction Services Canada, and although they have been, doing excellent work in those corrections, but we're identifying people that can be presented as potential volunteers to be deployed to Ontario. There are within Indigenous Services Canada, within a number of federal departments, we do have some medical resources that we are seeking to deploy. So far, as I've said, 62 have been identified, but we'll continue that work. With respect to the Canadian Armed Forces in Ontario, at this point in time, we are deploying 9 ICU nurses from the Canadian Armed Forces, and as well, Ontario has asked for 3 multi-purpose medical assistance teams names. I don't have a precise number, but that we'll provide that to you from the Canadian Armed Forces. We've had a number of very significant Canadian Armed Forces deployments in Ontario, and it really is based on the work that we do between our officials. The professional public service in the Government Operations Centre works with the professional public service in Ontario to identify what they need, and then we work very hard to meet their requirements and requests.
Merci. On va maintenant passer aux questions dans la salle.
Oui, question pour Dr Tam et Dr Njoo. J'aimerais avoir une réponse à savoir, pour vous, là, est-ce qu'un touriste qui entre au Canada, qui a reçu ses 2 doses, est-ce que c'est un risque du point de vue sanitaire? I will repeat it in English for Dr. Tam. For you, is a tourist who has received his 2 doses who come in Canada represent a health risk?
Dr. Njoo, est-ce que peut-être moi je peux commencer. C'est intéressant votre question. C'est toujours une question entre une personne individuelle. Tu as parlé d'une touriste et aussi si on parle de la santé, la sécurité à l'échelle de la population. Je pense que Dr. Tam et moi, on a déjà précisé, on a présenté avec notre présentation, je pense, le vendredi passé, que c'est toujours un objectif, un but de vacciner le plus grand nombre de Canadiens le plus rapidement possible. Donc, on pense que si on peut-être on peut atteindre une couverture vaccinale ici au Canada, peut-être que 75 de la population avec une dose et peut-être aussi 20 avec 2 doses de vaccins reçus. On va voir c'est quoi la situation, parce que ce n'est pas seulement une question de vaccination. On sait que les vaccins ne sont pas 100 efficaces, mais ils se donnent un bon niveau de protection. Donc, à l'échelle de la population, il faut regarder aussi c'est quoi l'épidémiologie à l'échelle locale, mais aussi à travers le pays. Et on a commencé de voir qu'il y a des bons résultats parmi nos aînés, aussi les autres populations vulnérables, concernant le résultat de la vaccination pour ces groupes prioritaires. Si on parle de la frontière, le premier ministre a déjà constaté, ça c'est peut-être une autre question d'enjeu parce que c'est déjà, comme dit, quelque chose accepté qu'il y a des exigences entre les pays pour des certificats. Par exemple, pour la fièvre jaune, si vous voulez voyager à quelques pays où il y a beaucoup de fièvre jaune, il faut avoir un certificat montrer qu'on a été vacciné. Donc, pour les touristes, les personnes qui peut-être qui veulent rentrer au Canada avec la vaccination, c'est un enjeu actuel parce qu'on est en train de discuter, consulter avec plusieurs pays parce qu'il y a beaucoup des aspects, des normes, même pour l'aspect technologique, mais aussi des autres enjeux parce que ici au Canada, on a une gamme des vaccins homologués, approuvés, mais il y a aussi des autres vaccins qui sont homologués, approuvés dans des autres pays. Donc, est-ce qu'on va accepter quelqu'un qui a été vacciné avec un vaccin pas approuvé ici au Canada? Donc, il y a beaucoup de questions, mais c'est avec ça, c'est difficile de vraiment donner une réponse. Avec une personne individuelle, est-ce que ça pose un risque? Je pense que c'est plus une question à l'échelle de la population. Mais avec ça, je peut-être vais tourner vers Dr. Tam pour les autres commentaires. Merci.
I think we have to recognize that I think the vaccines that we have, and certainly the ones that are authorized for use in Canada, look like they have a really good effectiveness, certainly against severe illness and deaths. And I think increasing studies showing that they also prevent asymptomatic and symptomatic infections. But there's not enough data on some of the vaccines at the moment. So I think the data is looking pretty good towards the direction that vaccines probably do protect against a reduction in transmission. The extent to which they do that is an evolving scientific study. But I do think that they can reduce transmission. I think it's looking that way, but we don't have the data for all vaccines. So I do think that there is a reduced risk potentially in those who are vaccinated. But if you kind of think about the situation another way, which is how much risk do they pose to Canada? So every layer is a layer of protection. They pose much less risk if the Canadian population has a high vaccine uptake, so that we can tolerate more potential risk of transmission from that perspective. So I think it's an interplay between getting our vaccines up and getting the rates of vaccinations up really high, so that we can potentially have people who come in who've been vaccinated, posing not just less of risk to themselves, but to each other as well. So that's another concept we're trying to work through.
Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Dr. Tam and Dr. Njoo. Health officials have repeatedly said that all of Canada's approved vaccines protect extremely well against severe illness and death. But is that true for just one dose of a COVID vaccine? What immunity does one dose provide, and what should people know about the risk of contracting COVID as they await a second dose? And similarly, when will Health Canada provide guidance on what people with one dose and those who are fully vaccinated can do?
Yes, so there's increasing evidence that in real life data that one dose of vaccine protects very good protection against serious illness and deaths. And even at a stretch interval, you can see that impact moving beyond the sort of 12-week mark. So that one dose is highly effective, but it's not as good as a second dose. So everyone who has a vaccine that requires a second two-dose schedule should get that second dose on the whole. And that will provide increased protection and also increased duration of the protection. And so you have seen, I think, how even one dose of vaccine has reduced long-term care, home impacts, and also, as we mentioned in our opening remarks on Indigenous communities that have received at least one dose of the vaccine, that it is an extremely important measure. But again, it's not 100%. So people should keep up with personal protective measures and observe public health advice in terms of what is going on in the community. We are also, of course, continuously monitoring any vaccine effectiveness studies against the variants of concern. And so we have seen that on the whole, most of the vaccines studied seem pretty effective against that B117 variant, which, as I've said, probably occupies over 90% or 95% of the variants in Canada. So that's good news. Even if it's slightly reduced protection, it looks pretty good. For the other vaccines, for the other variants, there's some data, but kind of limited, that suggests they may have a reduced protection against some of them. But they will still provide some protection. So the bottom line is still to get vaccinated. But I think our most important message is to be really clear to Canadians is that it doesn't matter whether you had one dose or two doses at the moment. Please observe all public health practices because we're in the middle of a big third resurgence, and that now's not the time to sort of let your guard down. But when the community is better protected and we protect each other, then we stand a much better chance to be able to lift public health measures with that resurgence.
Yeah, it's Dr. Njoo. Maybe I just add a couple of points to what Dr. Tam has already, I think, covered very well. And that's the interesting, I think, the way you put the question in terms of sort of the mindset, right? Of course, at an individual level, you have a very good level of protection with one dose. And we've seen that from the real world experience. And the immunity is long lasting. And even with sort of an increase in dosing interval, you have even better protection after two doses. But rather than looking at what an individual could or should be able to do, after 1 or 2 doses. The way we're looking at it in Canada, which is similar to, I think, other countries like the UK, is more of a collective or sort of a population approach. So the fact that you get vaccinated is good for yourself, obviously, to protect you and your family, but it's also protect others in your community that you don't necessarily know, because it reduces transmission and so on. So at the end of the day, what we've been talking about is that maybe collectively, it's not about what you can or cannot do after 1 or 2 doses. Is that, hey, let's look at your whole community. What is the vaccine coverage? If we're maybe looking at the potential an aspirational goal or something that will follow with the science. Maybe if, let's say, 75% of your community has received 1 dose, and then hopefully everyone is going forward and getting their second dose, and you have a good level of sort of vaccine coverage for that second dose as well. Then we'll look at the indicators, look at the extent of community transmission, look at hospitalizations, deaths, and so on. And hopefully, obviously, we anticipate that those indicators will be favorable as more and more of the population gets vaccinated. So I think maybe the other way to look at it is not guidance for what you can or cannot do after 1 or 2 doses, but what the whole community, what measures could be maybe be less restrictive as we all, as a population and community, go forward for vaccination. Thank you.
We'll take one last question before we end this presser.
Hi, this is Theresa Wright from the Canadian Press. Just following up on your comments, Dr. Njoo, you mentioned, and on Friday, Dr. Tam mentioned that 75% of people will need both doses before we can start easing restrictions. So just trying to get a better sense of what you mean by easing restrictions. And does that mean, for example, that Ontario and Quebec have to have both doses before we start seeing those restrictions starting to be eased?
So maybe I'll start. So the modeling that we presented on Friday is a tool for us to look at what could happen if certain parameters are met. And so we presented a range of different scenarios. Well, 2 of them we highlighted, but there's many ranges of scenarios. In one of the scenarios, it's where 75% of the population accepts vaccine together, and 20% of the population has received a second dose. You lift at that point in time more restrictive measures in terms of these closures that you've seen, and any number of them, then you stand a chance for those measures to be lifted without a resurgence that can impact your health system. So we looked at one aspect of the impact of the pandemic, which is on hospitalizations. Because right now, people are concerned because the hospitals are severely impacted, ICUs are full. So when you get to that kind of level of vaccination with a whole bunch of assumptions built in about how effective these vaccines are, what the variants are doing, and whether we got this third wave under control, that will be a time to examine whether we can really ease those restrictive measures while keeping up with the layers of personal protection and the testing and contact tracing. That would be a sort of a scenario that we can aim for. But those scenarios can be adjusted over time, but it gives you an idea of the kind of levels of vaccination that we need to strive for, so that when you lift these measures, you're not back into a resurgence again. That's going to overwhelm your health system. For now, everyone's focus must be to flatten this third wave, and don't let go sort of halfway, 2/3 of the way. Get those numbers down. Then we have a chance for the vaccine to take effect and be able to test and trace and contact trace the smaller number of individuals then that gets infected. And so then you stand a chance of lifting measures without having to come down to another of the more restrictive things that we're seeing right now. So that's the idea of the model that we did on Friday, but we'll certainly provide updates as we have more real life data to feed into them.
Thank you. It's Dr. Maybe just to add a few more bits to what Dr. Tam has said. Yeah, for now, obviously, we're in the third wave, and certainly many regions, areas in Canada are certainly very, very stressed in terms of the healthcare systems, the number of cases, and so on. And you can see that there are even more, let's say, restrictive or local measures. For example, I think I'm aware of what's happening in Peel region in Ontario, where they're looking at what might be the threshold in terms of looking at let's say businesses and what should happen should there be 5 or more cases in the workplace. So those are the kind of local sort of measures based on local epidemiology that's very important as we move forward. So as Dr. Tam said, the public health measures, the personal protective measures, we need to keep at it for now. But I think what I think is hopeful, I think, is the fact that we've seen a lot of, I think, interest, and obviously you folks in the media as well, about sort of looking at the 75%, I think a good objective in terms of vaccine coverage for 1 dose, and then 20% for 2 doses, and so on. And I think what that indicates is that that's something to look forward to. That I think the news is very encouraging that more and more Canadians are going forward to get vaccinated. So I think in a healthy way, if it's sort of maybe even a competition between provinces, hey, let's see what our vaccination rate is this week and the number of doses administered compared to our neighboring provinces. I think that's good for all of us, because then as more and more Canadians get vaccinated, we'll have sort of a closer sort of attainment of the vaccine coverage we're looking for, and then we'll look at the data. And rather than, as you put it, like what can Ontario and Quebec do, I think probably I think as the vaccine coverage goes up in various parts of the country in specific areas, it might also be at the local level that we'll see what type of measures could be maybe be less restrictive based on local epidemiology and the impacts of vaccines, along obviously with sort of the good adherence to public health measures as well. Thank you.
Thank you, Dr. Tam, Dr. Njoo, and Ministers. This is what ends today's presser.